Hello, I hope you guys are doing well. Today we're going to actually do a lecture on medicine and ethics. Now, I want to remind you all again that I am trying to mesh together two books, so I'm doing the very best I can. I know there's some, a little bit of going back and forth with 13th edition, 14th edition, but I am doing the very best I can with that. Also, I wanted to remind you that tomorrow, the 6th, I'm actually going to be in surgery. And I just want to talk to you a little bit about what you have going on tomorrow and Wednesday. So what you're going to have tomorrow is you're going to be doing a Quizlet, and it is called Medical Assistant Ethics Review. And I like that because it had some scenarios, and then you would read the scenario, and beside it, it would have the key term that went in that scenario. So I left that up for you guys to kind of read through and just kind of do a little bit of thinking about that. I am also going to be putting your exam up for medicine and ethics tomorrow. It's a very short chapter, very short chapters in this module. And then you're going to be moving on to read your next chapter. I just want to remind you guys of the process. It's going to be either read lecture or lecture, read, and then workbook. I mean, it's that way almost every single time. So if you get a little bit lost on what's going on, just read your chapter, listen to your lecture, and do your workbook that goes with that chapter. Okay, so on Wednesday, you're going to have another Zoom lecture, and you're going to have your workbook. And so that's pretty much it. I will get out of the hospital Wednesday, so I will be available Wednesday afternoon. But if you guys run into any trouble or you're not understanding a question, please reach out to each other. Ms. Holly will be available at the school. If you guys need anything, I'm just thinking I'm going to be fine in the afternoon. So if you text me and I text you back, or if you text me and I don't text you back, you know what's going on. So anyway, okay, off to our lecture. Going to share our screen. Well, move. There we are. This is on ethics, medicine and ethics. So let's define ethics. Ethics are called moral philosophy, the discipline concerned with what is morally good and bad and morally right and wrong. The term is also applied to any system or theory of moral values or principles. So do you think that there are personal ethics and work ethics? What if what you feel is right, what you feel like is morally correct, but then what your employer feels like is morally correct? What if those two things conflict? You really kind of have to think about that, because when you're on the job and when you're working for someone, your personal ethics do not matter. It's the facility that you work for. Those are the ethics that matter. Morals is defined as ethics is based on well-founded standards of right and wrong that prescribe that what humans ought to do, usually in terms of rights, obligation, benefits to society, fairness, or specific virtues. So morals, I think when you're brought up with a standard, or most people are brought up with a code of conduct, what you feel is morally correct and what you feel morally is wrong. Let's differentiate between personal and professional ethics. Personal ethics, these involve your morals and values. They are instilled generally during childhood by your parents, family, and friends. They relate to your deep-rooted principles, and how religiously you follow them determines the kind of person you are. The nature of your personal ethics depend on whether your principles have an optimistic effect on the people surrounding you. For example, your strict adherence to your principles must not spoil someone else's life. A negative impact on society due to your principles violates the very reason you are following them. These involve okay, let's talk about ethics. I'm sorry, guys, I missed that professional ethics. These involve a strict code of conduct laid down at the workplace. Your ethics are involve adherence to rules and regulations. Non-compliance to such rules may risk your reputation, as your behavior will immediately be reported as brash and unprofessional. Your personal views and concerns about any topic will not be much of help in a corporate setting. How well you follow the protocol of the company is what will matter. Let's identify the effect of personal morals on professional performance. So let's talk about punctuality. No company will tolerate employees who aren't punctual. My rule is 15 minutes early. I know that some of us run 15 minutes late and you think you don't have 15 minutes in the mornings or whatever, but I'm going to tell you, I was raised with the early bird gets the worm. I am 15 minutes early. If I'm not here, well, at Unitech, I'm probably anywhere from an hour to 45 minutes early. But in my old job, if I wasn't there 15 minutes early, they were calling to check on me because they knew when I was going to walk in the door. Time management. Do not whine if you are assigned extra work. Time management is crucial for rising up the corporate ladder. Learn the art of managing work in less time, and you will be a shining example for your colleagues. Now, how will that help you as a coder? I'm just going to say one word: organization. You must be organized. No matter what job you do, you need to be organized, because if you're organized, then you will work much more efficiently. Okay, so no gossip. You guys are all mature young people, so you know this is an important rule that you must follow. Your workplace is not a place to gossip, especially about your boss or colleagues or even your ex-colleagues. This will ruin your reputation and label you as a troublemaker. Safeguard company privacy. Some companies even ask their prospective employees to sign a legal document preventing them from discussing work outside the company premises. So preferably, maintain this policy. Do not discuss your projects or contracts outside the office, and if you do, make sure you have prior permission and do not reveal too much in any case. This rule is even more stringent with lawyers and psychiatrists, since they are not supposed to discuss or divulge any details about their clients. Well, you know, or you should know, that working in the healthcare industry, you cannot discuss anything to do with what's going on. You just simply can't do it. Y'all give me just a second. I need a all right, I'm sorry. We have graduation the next couple of days for our previous graduates that was supposed to graduate in May. And I had somebody that was a little concerned that they were missing graduation. Okay, so let's talk about grooming. Personal ethics. They are developed over a period of time. They can be instilled during your childhood by your parents and people close to you. The way that you look, although it upsets my sensibilities a little bit that people should not be judged on the way they look, it's just not practical. They're going to be. You're going to be. So if you're disheveled and you're not clean and you don't have combed hair or what have you, you're not going to look professional. You're not going to make a good first impression. So I'm not going to read all of these things because I think that you guys understand that looking professional and what you need to do that is of the utmost importance. Satisfaction. Personal ethics. They satisfy your personal needs. They only influence your behavior with people you know personally. They define who you are and help you to take decisions, and hence control your attitude towards the people you care about. Whenever you take any decision keeping these values in mind, you're invariably think of how it's going to affect you, your behavior, or your family and friends. Personal ethics, they satisfy your corporate needs. Your professional career is influenced by these rules, and the more stringently you follow them, the better professional you will be. These values help satisfy the need to feel compatible of making fair decisions regarding your position in your workplace. Results, personal ethics. Following these ethics result in clear conscience, positive attitude, and a contented spirit. This is because you follow them for yourself and your loved ones. So let's move over to professional ethics. The results are more predictable, common, and obvious in this scenario. Following these ethics may result in you being honored as a diligent employee and sincere worker. Not following them may result in being blacklisted in the organization, attract legal issues, or loss of money and reputation. These are followed more for the sake of your colleagues, bosses, and society. Reliability, personal ethics. They rely only on the individual. They are designed by the person himself to make his life more orderly and disciplined, and he depends on them to define his life. Professional ethics and reliability. They rely on the organization. They are formulated and laid down by the organization, and they need to be upheld by whoever works there, irrespective of his designation or salary. The same rules need to be applied outside the workplace. They are confined within the company, and they need to be followed with utmost decorum. So we're going to list and describe 4 ethical principles in healthcare. Autonomy. In medicine, autonomy refers to the right of the patient to retain control over his or her body. A healthcare professional can suggest or advise, but any actions that attempt to persuade or coerce a patient into making a choice are violations of this principle. In the end, the patient must be allowed to make his or her own decisions, whether or not the medical provider believes these choices are in the patient's best interests, independently and according to his or her personal values and beliefs. 2. Beneficence. This principle states that healthcare providers must do all they can to benefit the patient in each situation. All procedures and treatments recommended must be the intention to do the most good for the patient. To ensure beneficence, medical practitioners must develop and maintain a high level of skill and knowledge, make sure that they are trained in the most current and best medical practices, and must consider their patients' individual circumstances. What is good for one patient will not necessarily benefit another. Non-malfeasance. Non-malfeasance is probably the best known of the 4 principles. In short, it means to do no harm. This principle is intended to be the end goal for all a practitioner's decisions, and means that medical providers must consider whether other people or society could be harmed by a decision made, even if it is made for the benefit of an individual patient. Justice. The principle of justice states that there should be an element of fairness in all medical decisions. Fairness is in decisions that burden and benefit, as well as equal distribution of scarce resources and new treatments, and for all medical practitioners to uphold applicable laws and legislation when making choices. Okay, so let's demonstrate some appropriate responses to ethical issues involving genetics. There are many ethical issues in healthcare, and as technology and medicine evolve, additional ethical issues will arise. Types of genetic diseases include monogenic disorders and chromosomal disorders. Cloning is the process of creating a genetically identical biologic entity. Genetic engineering is the manipulation of genetic material in cells to change hereditary traits or to that should say to produce a specific result. I'm sorry, guys. It's or to produce a specific result. My mouth just wouldn't say product. I knew that was not what that was supposed to be. Okay, the next one. Genetic testing can identify issues with a person's chromosomes, genes, or proteins. Some types include newborn screening, diagnostic testing, carrier testing, prenatal testing, pre-implantation testing, predictive and pre-symptomatic testing, and forensic testing. Pharmacogenetics is a branch of pharmacology that studies the genetic factors that influence a person's response to a medication. Stem cells differentiate or develop into specialized cells. Gene therapy is currently an experimental technique that uses genes to prevent or treat diseases. So let's talk about reproductive issues. In vitro fertilization involves removing eggs from a female's ovaries, which are fertilized with sperm cells outside the body before being implanted in the uterus for pregnancy. Intrauterine insemination is when specially prepared sperm is placed into a woman's uterus. Surrogacy is when a woman carries and gives birth for another couple. Infertility is the inability to get pregnant after 1 year of unprotected intercourse. Gamete, egg or sperm donations allows others who are unable to have children to do so. Egg freezing is the cryopreservation of oocytes. Cryopreservation of oocytes. There we go, we got it that time. Which is done to preserve the female's fertility. Elective abortion is the deliberate termination of a pregnancy. Childhood issues. Adoption. Safe haven infant protection laws allows a person to give up an unwanted infant anonymously. Varies from state to state, and confidential health care for minors. In most cases, parents of minor children must authorize or decline treatment. It is important for the medical assistant to represent the patient's Bill of Rights. Research trials. Influential guidelines and codes of ethics that guide clinical research. Nuremberg Code, Belmont Report, and Declaration of Helsinki. There are 7 main principles involved in ethical research: social and clinical value, scientific validity, fair subject selection, favorable risk-benefit ratio, independent review, informed consent, respect for potential and enrolled subjects. Many of the larger ambulatory healthcare facilities are involved with teaching nurse practitioner and physician assistant students and residents to become future healthcare providers, and research trials are conducted. So let's talk about Elizabeth Kubler-Ross. She came up with these stages of grief and dying: denial, anger, bargaining, depression, acceptance. So now we're going to demonstrate appropriate responses to ethical issues involving organ donation issues. So we're going to discuss the Patient Self-Determination Act and the Uniform Anatomical Gift Act. We're going to define terms related to the organ donation issue: advance directives, living will, medical durable power of attorney, healthcare proxy. Your assignment to go along with this Zoom is I would like for you to define each one of those terms: advance directive, living will, medical durable power of attorney, healthcare proxy. So you really, really, really need to know the difference between living will and advance directive. All right, so let's move on. The PSDA, Patient Self-Determination Act, is an advance directive written institutions about healthcare decisions should a person be unable to make them. Living wills, medical durable power of attorney, healthcare proxy, organ donation, and DNR, which means do not resuscitate. Physician orders for life-sustaining treatment, POLST, one-page physician order sheet that indicates the care a person should receive. Uniform Determination of Death Act, UDDA, served as a guide for lawmakers to create their own laws. Person may be legally be declared dead if one of the following two events occurs: irreversible cessation of circulatory and respiratory functions, irreversible cessation of all functions of the entire brain, including the brainstem. Withholding or withdrawing life-sustaining treatment can be emotional for the patient and family, can be ethically challenging for healthcare providers, and if the patients cannot make these decisions, it is up to the patient surrogate. Now, we've been talking about what we think about personal ethics and professional ethics. One of the things that you guys have to understand, especially if you're working in a hospital setting, say you start out like I did as a hospital secretary. You're going to see so many people make these decisions. It is not your place to judge or comment. Your ethics and values cannot be transferred over to a patient and their families. So you guys just need to be careful about how you, what your attitude is. You must always be professional, kind, and considerate. Let's talk about euthanasia. That is the act of killing a person who is suffering from an incurable disease. Can also be called a mercy killing. There are different types: active, passive, voluntary, involuntary, self-administered, other administered, and assisted suicide, or suicide assisted. Let's talk about organ donation issues. More than 114,000 people in the United States need a life-saving organ transplant. More than 74,000 people are on the active waiting list. 6 people are added to the national transplant waiting list every hour. So let's discuss cord blood banking. I'm sorry, guys, I did not get my book out, so I'm going to get that out so that I can find that and we can read it together. I'm just going to pull the 13th edition. And that is actually found, well, of course, now that I'm looking for it, I'm not going to be able to find it. So I'm going to look it up in the back of the book, blood banking. I'm sorry, I did not mean to not be ready for you guys, but it's kind of like in class whenever we forget something and we have to run get it. Okay, so the definition of blood banking: an anatomic, psychologic structure made up of astrocyte glial cells that prevents or slows the transfer of chemicals into the neurons of the central nervous system. So that is what blood banking is. And as you read through your chapter, you're going to be able to see more. Okay, so what are the 3 types of living donation? There's directed donation, where the donor specifically names the person to receive the donation. Non-direct donation, where the donor does not know the person nor is related to the person. And paired donation, where at least 2 pairs of living kidneys are involved. With organ donation, justice and medical utility are factors that are balanced. With organ donation, justice and medical utility are factors that are balanced. You saw that I went back small because when I blew it up big, it left off my balanced word. So we're going to go back up again. Thank you guys for your patience for me not having my book out. I do apologize. Okay, Uniform Anatomical Gift Act, UAGA, was revised in 2006, and it clarified who can make donation decisions for patients. It strengthened language on protecting patients' decisions on donating or not donating organs. It established standards for donor registries. It was enacted in 1968, and all 50 states have adopted this law. National Organ Transplant Act, NOTA. It established the Organ Procurement and Transport Network, OPTN. It established a national registry for organ matching, made it a criminal action to exchange organs for transplant for something of value, for example, money. The NOTA was passed by Congress in 1984. Xenotransplantation. I'm going to read the little tab to the right. It says pig heart valves are already being used to treat human heart valve issues. So xenotransplantation is any procedure in which non-human cell tissues or organs are implanted or infused into a person. Currently, pigs are animals of choice, and their organs are about the same size as humans, and they breed quickly. Patient coaching and patient-centered care. Medical assistants should take a serious look at the thoughts and concepts that make up their own concepts of ethics. It is important to approach ethical decisions calmly, logically, and without haste. Confidentiality is always critical in the medical profession, and the patients must understand ethical standards. Okay, so that is our lecture for, and you know, I keep thinking, I don't know what chapters it is because I have so many chapters going on in my head, but it's medicine and ethics. I have my my 13th edition right here. So medicine and ethics is actually chapter 7 for the 13th edition. And I'm just going to roll on over, guys. Bear with me to grab my other book, which is packed up because I was working up front. Oh, you guys get to see the pretty bulletin board behind me. So let's see, medicine and ethics is going to be healthcare ethics for the 14th edition. It's called healthcare ethics. So chapter 7, 13th edition, chapter 5, 14th edition. So do not forget that you have an assignment. You need to know the difference between a living will and advanced directive. And the other terms, I think there was just 4, those terms, you need to take the time to define those, and you really need to know them, okay? So I hope you guys have a great afternoon, and I will be touching base with everybody tomorrow evening. I'll just text you after I get out of the hospital and I get home and I get settled. So you guys have a great day. Bye-bye.